Good morning, everybody, and thank you very much to the Australian Institute of Criminology and the Victorian Safe Communities Network for the invitation to be here today and to speak with you. I'm actually a visitor from Sydney, and I'd also like to acknowledge the Wurundjeri people, the traditional owners of the land and ancestors past and present. Today I've been asked to come and talk to you about social marketing techniques and crime prevention and community safety. Right from the start, I'll acknowledge I'm not an expert by any means in crime prevention and community safety. I've been working in social marketing for a long time, and I've had the opportunity to work at a state government level, a national level, an international level, across a range of public health areas, and I think there's a lot of lessons that we can learn from the application of social marketing and public health to this area. I'll just see how I can work. A very good friend of mine and colleague of 30 years, Peter Hommel, who some of you may well know in this area, started a conversation with me a few years ago about exactly that point, about social marketing and public health, and how can we, are there abilities to transfer that learning into crime prevention and community safety. And we ended up writing a Trends and Issues article exactly on that. And that was about transferring the model of social marketing that I developed through my own PhD studies and work with the federal government in terms of the national public health campaigns that we had conducted through there. So today, I think the task that was set for me is to really explore what is this social marketing really about? What are the primary principles that really come to play in social marketing, and what is the process of developing, implementing and evaluating a social marketing intervention? And of course, during that discussion, what are the opportunities for application in terms of the crime prevention community safety area? There was a lot of discussion in the early years about what social marketing is and isn't. It started really back in 1952 when a fellow called W.D. Weeb first asked the question, why can't we sell brotherhood like we sell soap? This was an idea that there's been a lot of work and a lot of expertise generated in selling products and services to people, and some fundamental principles about how most effectively to do that. And maybe there's a way of applying that in other areas of human behaviour to benefit the individual and the society. And it didn't really come into the health promotion literature till 1998, when Craig Lefebvre, who'd been working in the Pawtucket Heart Health Program in the United States, and June Flora, who'd been one of the directors of the Stanford Heart Disease Prevention Program, wrote an article in Health Promotion Quarterly and started to introduce this idea of applying marketing techniques in terms of influencing health behaviours. And this was at a time in the 1980s where health promotion was in a lot of ways grounded with these small group community type of programs about healthy lifestyle programs and lose weight and reduce stress and quit smoking. And it was very clear that these sorts of programs were in a lot of ways not reaching the people who most needed them, and that there was a desire to try and transform into population health programs. And use of media, of course, was a way that could actually make that transition. But there was a lot of discussion about social marketing definitions. A fellow called Professor Alan Andreasen, who was the director of the head of the American Marketing Association in 1993 and wrote a book in 1995 called Marketing Social Change. His definition was that social marketing is the application of commercial marketing technologies to the analysis, planning, execution and evaluation of programs designed to influence the voluntary behaviour of target audiences in order to improve the welfare of individuals and society. There's a whole lot of stuff in there. Most of it won't be new to you in terms of people who are used to developing, implementing programs. But importantly, it was about recognising the ability to influence voluntary behaviours, and we all undertake plenty of voluntary behaviours today. We've all decided or made decisions about what we ate for breakfast, whether we've done any physical activity today, what we're going to do this afternoon, tonight. There's all sorts of decisions we're making all the time, and there are all sorts of influences on those decisions. What social marketing is about is becoming a player in influencing those decisions. Professor Rob Donovan and Nadine Henley over in Western Australia wrote the first social marketing book in Australia, text in Australia, called Social Marketing Principles and Practice in 2003. They introduced a slight addition to the Alan Andreasen definition around social marketing by talking about both voluntary and involuntary behaviour. And the example that they used was that if you create a tuck shop policy where there's only healthy food available in that tuck shop, then the children making a decision about what they eat are only going to be having healthy options to choose from. And this was a way of creating, if you like, a policy intervention which created a structural change in the environment. And even though young people were still making their choices about what to have for lunch, we'd limited the options into only healthy options. They also started talking about, as Andreasen, about the idea of both upstream social marketing and downstream social marketing. And now, a lot of you, maybe when you came today, would think about social marketing and just think about an ad or something, about an ad campaign telling people to change their behaviour. What I want to leave you with by the time you leave today is an understanding of a much more complex process that we go through in terms of developing, implementing, evaluating social marketing interventions. By upstream social marketing, we refer to actually the influencer process of influencing decision makers and policy makers who then can create structural change in a society which will also influence involuntary behaviours. So when we think about social marketing, it can be both upstream social marketing to influence policy and structural change, and it can be downstream in terms of more targeted about individual and group behaviours. And if we're smart, we can put a program together that does both. Social marketing is clearly not just about sending a message to an audience. It provides a framework for developing, implementing and evaluating a comprehensive integrated range of communication and structural interventions, and that's where you'll hear a number of reinforcement points, I guess, from what you'd heard John talk about. It's really about making health-enhancing behaviour easier. And that might be in terms of influencing what we think and what we know, but it might also be in terms of influencing the environment within which that behaviour takes place. If we look at what is it in terms of crime prevention, if we look at the UK crime let's keep it down type of strategy, the whole intent was about reducing the opportunity for crime and increasing the difficulty of crime by getting potential burglary victims, if you like, much more alerted to what needed to be done and how vulnerable they were, simply by taking action to lock up more and be more diligent around the home. In examples like the Road Crew program in Wisconsin, where they actually give people the option of being picked up and driven to a venue and then driven home, what you're doing there is, of course, making avoidance of committing crime easier. You make it more difficult to be a drink driver if you get picked up. Now, there are all sorts of implications about what that does to your drinking level when you're actually at the establishment, and there are conflicting health objectives in there. But from what they were doing in Wisconsin, it was about saying, yes, but fewer young people are being killed because they drove home drunk. And that was the justification of that sort of approach. In public health in Australia, social marketing has been used to promote engagement in health protection behaviours such as child immunisation, getting your child immunised, early detection programs, breast cancer, cervical screening, bowel cancer screening programs to get people to take action to early detection of problems and precursors of cancer, or cancer itself in terms of breast cancer. And individual behaviour change that we think about in terms of alcohol, tobacco and other drug use, sexual behaviours, injecting drug use behaviours around HIV/AIDS. And during the late 80s to 90s, it was picked up very strongly as a national population strategy in Australia. We were looking at things like smoking prevention and cessation, alcohol abuse, particularly through the drug offensive campaigns in those years, and same with illicit drug use, HIV/AIDS prevention, cervical cancer, breast cancer, mental illness, child immunisation. These are all big national strategies, and they weren't just campaigns. Child immunisation, for instance, was very much part of a 7-point plan where the campaign was there communicating with people, but there were also interventions with GPs, with incentives about needing to have your child fully vaccinated in order to qualify for the child assistance program and things like that for childcare costs. So these campaigns were part of broader population health strategies. Let me just show you, just remind you a few of these from what was going on in those few years. These are from 1997 and 1998, to show you what was going on in the airways at that time. This one was driven by a piece of research in terms of, and I'll talk about the process, but in the early process, it was very clear that people who were having children in these years weren't so aware of the potential harm from a lot of diseases that were still around, like whooping cough. And there was this assumption that Science had actually fixed that by now. So this strategy was about simply increasing the perceived susceptibility and reminding of the severity of a consequence if your child is not fully immunised.
When a child gets whooping cough, the disease develops from a low-grade temperature, then declines into spasmodic coughing, gasping and vomiting for up to 12 weeks. Then 1 in every 140 children will develop an inflammation of the brain, with the possibility of lasting mental and physical damage. And 1 in every 200 babies under 6 months with whooping cough will die. This is just one of the deadly diseases that is re-emerging because some parents are not fully immunizing their children. Until all our children are fully immunized, none of us can breathe easy. See your doctor or health clinic to ensure your child is fully immunized, or call the Immunization Info Line 1-800-671-811. Full immunization, our best protection against disease.
Now, this execution was a very simple idea, and by the way, that baby recovered fine, a strapping young boy now. But the point there was simply to raise that sense of, again, susceptibility and severity. It's a classic example of what we call a fear arousal or emotional arousal response, but a very clear call to action about something you can do to reduce that anxiety. Then in 1998, to just show you a campaign about the same, similar sort of issue. This was also about immunisation for measles. But here, the behavioural objective set is for parents to sign a consent form. That's it. The government was going to immunise children in schools. You just had to say, yes, it's okay for me. So the approach, the appeal here is very different. This is about just getting everybody on board, showing that this does mean something to me. This reflects the whole of children across Australia, but in a very positive, upbeat sort of way.
Together we stand, fight if we fall. Come on now, people, let's get on the ball and work together.
If you're a parent, this is important.
The measles immunisation schedule has changed.
And the second measles shot that used to be given to teenagers
is now given sooner.
So to make sure no child misses this vital vaccination,
every primary school will soon be part of
a one-off Australia-wide measles vaccination campaign.
In the next 2 weeks, all primary school kids will
bring home this measles information pack. Parents, you need to sign the consent form
so your child can be immunised at school.
So let's work together to beat measles.
Come on, let's work together.
And as a result of that campaign, 95% of children aged 5 to 12 ended up being vaccinated in Australia, which takes it to a level that in epidemiologists refer to as herd immunity, which was very, very successful in terms of reducing what had been predicted by epidemiologists to be a massive wave of measles in 1999 to be literally a handful of cases. And the previous campaign also had a significant increase in parents actually going along and getting their child vaccinated. But I show you these in terms of different sorts of appeals.